Welcome everybody at this very special webinar where we are actually talking about ChildHub, which as a project has been running for more than 7 years. And we have just ended the project. In the meantime, you will see our 4 questions. I would like to thank our donors, the Austrian Development Agency and Oak Foundation, for their long-time support of this project. We are really grateful for that. And today we are going to discuss the results of research that we have been conducting with the help of researchers that I'm going to present. The lead researcher is Dr. Tobias Schnitzler, who is going to speak first. He is the project coordinator at World University Service Austria. He has worked both in NGOs and in research institutions. He has a PhD from Vienna University. So he will be our first speaker to talk about the overall research results. And after that, we wanted to give you a glimpse into 2 specific countries, since while this project is quite regional, I believe that the most interesting aspects of the project are always in the countries. So our first speaker from Albania will be Dr. Ana Majko from the Initiative for Social Change ARSIS. She is also a PhD in psychology from the University of Tirana. After that, we will hear from colleagues from Romania. Irina Opincaru will talk about the research results in Romania. She's a PhD candidate at the University of Bucharest. She's working at the organization Concordia as a researcher, and her main field of activities, in fact, impact evaluation, NGO sector capacities and activities, community involvement, and data analysis. And she had a co-researcher, Dr. Claudia Petrescu, who is also a PhD, has a PhD from the University of Bucharest in sociology. She's a researcher, and she was working together with Irina on this research. So without further ado, I would like to give the floor to Tobias to start his presentation.
So thank you for this kind introduction. So hello everyone, I'm Miriam. May you switch to the next slide? So as Judith mentioned, I will start the presentation with the main findings of the ChildHub impact study. It's a pleasure to start with these main findings, and about Ana and Claudia from Albania and also from Romania will continue with key highlights from their countries. And in the end, I think in the last 15 or 20 minutes, we have an opportunity to discuss the next steps and also maybe the recommendations from the ChildHub. So next slide. So I will start with a short overview about our methodology. So in the beginning, we did a comprehensive desk review of all available documents, and then we were in close collaboration and also in discussion with the 8 country evaluators, and we provided that they should use 2 focus group discussions with professionals benefiting from the ChildHub projects. So in total, 14 focus group discussions were conducted directly with this group. And afterwards, we invited the country evaluators to conduct focus group discussions with professionals not benefiting from the ChildHub project, so that we have a control group and can compare these 2 groups. And in total, in this field, 13 focus group discussions were conducted in all 8 countries. And also, as an instrument, we invited them to use the key informant interviews. And in total, 61 key informant interviews were conducted. And we provided 1 online surveys for professionals in Albania, Bosnia, Bulgaria, Croatia, Romania, and Serbia. And in total, we got 81 respondents. And similar to our impact study, there was a final evaluation with another NGO, and they were responsible for Kosovo and Moldova. And with this online survey, we got 16 responses. So Miriam, may you switch to the next slide? So as I mentioned, the respondents were really active, and we got responses from all countries. We got 10 from Albania, 12 from Bosnia and Herzegovina, also 10 from Bulgaria, 7 from Croatia. Most responses came from Romania with 24 answers. There's an 18 from Serbia, and last but not least, 16 responses from Kosovo. And when it comes to the main findings, and also when we look at the impact on the beneficiaries, we got a really good result. So more than 40% answered the impact on the right of the child to be protected from violence, abuse, and realize their rights across the region is very high. And 28% answered it's above average. So we have almost 75% is very high or above average, and 13% answered it's on average. The impact on beneficiaries. So next slide, please. So I also want to highlight the multi-dimensional impact. So we also got a really good answer when it comes to the quality of care offered, or the organizational culture from terrorism. And to a moderate extent, it was mentioned that it's a more inclusive work environment. And also a good example that we have a really high child participation in the protection system. And maybe we can discuss these impacts or issues in our Q&A session in the end. Next slide, please. So now I will summarize main results from 6 different countries, and I will start with Bosnia and Herzegovina. So I divided the main results on impact on beneficiaries, on sustainability and empowerment, and also on diversity and inclusion. So, and when it comes to the impact on beneficiaries, it was highlighted in Bosnia that there's a need for future ChildHub initiatives, which should target especially policymakers in this country. And when it comes to sustainability and empowerment, it was really crucial that the most sustainable outcome of the ChildHub is the online platform itself, providing really useful information and also webinars to professionals in the field. And last but not least, the diversity and inclusion part, the participants recognized that the ChildHub is really used the bottom-up approach to reach children and youth. I will continue with Bulgaria. So the respondents mentioned that there's an increased quality of care by the model for cross-sector capacity building. It also increased the children's participation at schools, also in social services, a more inclusive work environment, improved capacity for advocacy was provided, and there's also an indirect impact on policy. From the sustainability and empowerment angle, there was a cross-learning among professionals. Also, that the platform provided really useful resources And this platform was a model for empowering. Last but not least, diversity and inclusion. There's an increased competence of professionals working with children and from vulnerable groups in the context of violence or maybe from disabilities. And want to highlight one quote. The ChildHub has elicited the standardization in social work and the resources for change, professional community and sustainable cross-learning. It was one researcher from the university in Bulgaria. Next slide, Miriam. So now I will summarize the main results from Croatia. It was also mentioned that there's a great empowerment of professionals in the field, that there's better quality of service. It was also highlighted that there are no systemic changes in the social protection system. When it comes to sustainability and empowerment, the ChildHub network and platform needs the management to stay sustainable. It's a really crucial issue when we want to discuss how to follow up or how to proceed with this project. And it's also really important to mention that the participants are really highly motivated to stay active in the network in Croatia. And from the diversity and inclusion angle, various aspects of diversity and inclusion were tackled through addressing social welfare. And the online model and work in remote areas contributed to equal opportunities for professionals, especially in this challenging time during COVID-19. I will continue with Kosovo. So the respondents answered when it comes to the impact on beneficiaries. Based on the findings, according to the majority of respondents, the impact was very high for Kosovo, or in the Kosovo context. It was a holistic, multidisciplinary approach for free access, and opportunities for regional cooperation have been highlighted by respondents. And also based on the findings, the sustainability of the intervention is high in sense of knowledge being transferred to relevant stakeholders. But the sustainability of the online platform is critical. There's a need to carefully think about the transition phase of the ChildHub platform. And according to the majority of respondents, diversity and inclusion were appropriately addressed in the ChildHub activities. It has paid attention to age, gender, disability. And now I will I think Moldova and Serbia. Okay, I will continue with Moldova. There's a respondents mentioned that all that they agreed that the ChildHub had a multidimensional impact, as I showed in the beginning with my figure. And that the most significant impact was on the policy-making process in Moldova. And the respondents had almost the same opinion, the sustainability of the project deliverables, as well as the multidimensional character of positive changes. And they also agreed that diversity and inclusion aspects were considered over the course of the project implementation. And now I think my last slide about Serbia. So when it comes to Serbia, there's, I think it's same impact and analyzes that the quality of care was increased, that the capacity of the implementing organizations, the use of a multi-sectoral approach was used, and that we had a regional perspective. And also said diversity inclusion were considered as a really valuable principle, and that there's a meaningful participation of children and professionals. And last but not least, there's an equal access to diversity groups. And I will end with a quote. Serbia strongly promotes principles of inclusion, both on the legislative and public policy level, but the practice is still under development. So there's an ongoing process in these fields, and time is an essential factor of substantial progress to be made in this field. So thank you for your kind participation, and I will hand over to Ana, and she will continue with key highlights from Albania. So thank you again.
Thank you, Thomas. And thank you, ChildHub, for making this possible to share the results about the impact study in Albania. As a researcher, but at the same time as a key resource person of the ChildHub and a beneficiary of the ChildHub, I can say that I'm very glad to share findings that are in the same line with my perceptions and what respondents has been sharing during the research process. The child protection system in Albania is, I think in the last 10 years has been developed a lot, and one of the promoters and contributors in the development of this child protection system has been for sure ChildHub. Through the new law of child rights and protection has defined very structured, complete framework of rights, protection measures, services, but the child protection workforce has been very new. And the ChildHub approach for reaching this child protection workforce, new child protection workforce, was very highly proactive and engaged and committed to develop through curricula, through trainings, webinars, supervision, peer-to-peer, and a package of other activities. Improvement of the legal framework of the policies, of the developments, raised awareness for professional capacitations, changing attitudes and perception, economic developments are some of the main factors who have been impacted by the overall changes in the child protection system in Albania. One of the main findings of the research in Albania has been the role of the ChildHub in the capacity development of the stakeholders as an ongoing process, as an incremental process, including capacities in online meetings, webinars for the older group ages of profession in Albania. One of the quotes of the State Agency of the Child Rights and Protection has been the ChildHub has been a very supportive role on the child protection system, empowering and equipping practitioners, academics, and policymakers in child protection with tools, resources, and opportunities. Based on that, we can say that the ChildHub in overall approach in Albania has contributed to the establishment of a very consolidated network of professionals in child protection from different sectors: health, education, police, agencies, institutions, mostly child protection workforce, civil society sector in general, with different levels of understanding of principles of child protection, and with a very common interest for further development of motivation for learning and need for capacitation. Also, ChildHub has been very engaged to make sure that its continuance in the child protection system is a unique platform dedicated to professionals and system in overall. The next slide, please. What has been, yes, one of the main activities and the main major focus of the ChildHub has been to the new child protection workforce, with a very interactive way through supervision or peer-to-peer mentoring systems based on the volunteer initiative of resource persons and other ChildHub members. Like 80% of the respondents shared through focus groups and interviews that this supervision sessions has been very useful, is specific in treating specific cases, difficult cases of children at risk of high risk of abuse, sexual abuse, trafficking, etc. So this supervision sessions has been one of the strongest points of the ChildHub, especially during the COVID pandemic situation and during restriction from the state government. ChildHub has been also developed in years through great methodologies and practices for ensuring capacities and learning for professionals, but at the same time has been organized in very interesting activities through TOT trainings, analysis and research in specific topics like violence and bullying in schools, and through case management process. The next one is the main categories of children at risk that has been mainly supported and shared by the respondents during these 7 years has been children with disabilities, children in alternative care, children in conflict with the law, unaccompanied children, and children at risk of violence and several forms of hard abuse. Child protection workers have been one of the main group of professionals who have benefited directly from the ChildHub's activities for the service provision directly to the most vulnerable groups, and in most of the cases promoting these positive practices. Child protection workers are the people who are responsible in the local governmental units to provide this kind of support to children at risk. And we can say for sure that in Albania, the ChildHub is the only one library in regional level in different languages, accessible and flexible for all the professionals in different levels of understanding, studies, articles, publication, reports related to the child protection development. This platform has ensured in years in an innovative way for exchanging an e-learning process for professionals, especially during the pandemic situation here in Albania. One of the main achievements of the platform, distinguished among others, is the sustainability of the care resource persons in years, contributing voluntarily based to exchange and contribute that will be, I think, and suppose even in the near future with the child protection system and professionals in Albania. I think this is all, but for any kind of comment and suggestion, I will remain available. I'm very happy to share more. Thank you.
Irina, would you continue, please?
Hi, sure. I was just waiting for the start. Hello, I am Irina, and as Judith already presented, I was one of the researchers that took care of the study in Romania. And I worked with Claudia Petrescu that cannot attend today, and she's really, really sorry that she didn't get to join us. I will, however, take over her part also to present the main findings and some highlights of the study in Romania about ChildHub's activities and main results. So as a very, very brief presentation of the main findings regarding the impact on beneficiaries, the most important impact that we observed and we were able to analyze was related to the capacity development of the professionals in the social protection field. Mainly as a result of the ChildHub platform, the learning activities for the professionals and the mentoring or peer-to-peer learning sessions. This capacity development translated immediately in their activity with the direct beneficiaries of the social services. And they observed an improvement in this area due to ChildHub's activities, the platform, the mentoring sessions, the peer-to-peer learning sessions. Regarding sustainability and empowerment, the activities that are considered still the most sustainable are in some public institutions, the peer-to-peer learning sessions, including the workshops and the mentorship, and they keep organizing this kind of sessions even after the end of the ChildHub project. The platform in general is seen as one of the most valuable results and the one that has the best sustainability in the future. And in particular, the e-learning modules were seen as really, really important and how do I say, to be kept in the future. Regarding the diversity and inclusion, one of the areas most impacted by ChildHub was the one regarding the meaningful participation of children and professionals. This was made through the direct involvement of children and by offering a very wide range of opportunities to a variety of professionals, not only experienced professionals, but also early career and professionals working in different environments, small urban areas or rural areas, which had access to a variety of materials and information which otherwise they couldn't come by. Okay. So a bit of more detail on each of these impact areas. As I told you, the quality of care offered to the direct beneficiary was impacted by ChildHub activities. Through the professionalization of the child protection workers, and mainly this being made by the platform with all the online resources available in all languages, as Anna mentioned, that the platform is unique in this sense, and with all the learning activities. During focus groups and interviews, professionals specifically mentioned the peer-to-peer learning sessions as really impactful, a tool to learn new information about how certain cases are approached and addressed in other departments, in other services. They had the space to find out about new methods of intervention, to regulate their own opinions and perceptions, and to find ways of approaching different types of beneficiaries. The face-to-face and online mentoring sessions with people from different institutions also improved collaboration and communication in the area. We can go to the next slide. Okay, child participation in the protection system knew several improvements as a result of the project. First, by involving children in all local and central meetings, which was facilitated by the development of the online and digital systems, which made participation easier. And this was also something that was related to the COVID-19 pandemic, which fostered and, how do I say, a bit precipitated this approaching of online and digital tools, because it was the only option at the moment. Also, on the ChildHub platform, there were promoted tools for various materials like videos, posters, etc., made by children involved in other TDH projects. Overall, this fits into TERDE's own direction of involving children in all projects and in all their initiatives. The aspects of making the work environment and organizational culture more inclusive were seen as one of the most important effects of the peer-to-peer program and mentoring sessions. They consider that ChildHub not only contribute to transfer the information to professionals, but also focused on personal development issues, on how to avoid burnout or on intervention in different areas. We can go to the next slide. The platform, again, was the main outcome of the project, and it was already used and had a significant impact on professionals in different public institutions and in civil society. We gave here some examples. The platform was used during the didactic activity by the teaching staff in the Faculty of Sociology and Social Work of the University of Bucharest. One of the teachers there was a resource person in the project and took the platform and disseminated further. It was used during training activities in other TDH projects. It was recommended during trainings. It was recommended to teaching staff during their activities. And it keeps living on and keeps being used by interested professionals. Also, the peer-to-peer learning program is seen as really sustainable, and it's already, and it was still organized even after the end of the project. We can go further. Diversity and inclusion are aspects of great importance in all TDH projects, and also in ChildHub, these aspects were approached in quite a high level. The issues of age, gender, disability, socioeconomic situation, and other diversity and inclusion experts were considered, and this is according to all the beneficiaries we've interviewed, by project partners and by the professionals who worked with different categories, including in the area of vulnerable and marginalized groups. The platform had available materials specifically made for professionals working with different categories of children, especially targeting gender differences, ethnic aspects, or issues of working with refugee children or children on the move. Materials which I think proved to be really valuable considering the burst of the war in Ukraine. At professionals level, the project offered opportunities for professionals from different backgrounds, as I said before, and also possibilities for professionals with reduced opportunities to participate in trainings and in mentorship programs. We can go on. Okay, some recommendations that we identified during the interviews and the focus group was first the continuation of the platform, which would be great to be updated periodically or and added up with more information. Also regarding to the main areas with resources to approach subjects as children in poverty, access to education for children in need, and other subjects. Also, the e-learning modules could be improved with new information and new topics to keep the platform going and keep it active. And a proposal was about the project being continued in the area of inclusive education, as well as in the area of parental education. So that the information on the platform to be known by parents also, and to get them trained and to make them aware of what it means to protect the child. I'm not sure if I have one more slide. No, thank you very much.
So this is just a short start of guiding questions. So maybe what is the most surprising result during our impact study? Have there been any controversial issues you have come across, and also how interested were key stakeholders in the continuation of the ChildHub? And I have seen in the chat that one person asked a question about diversity and inclusion. So when it comes to inclusion, we used the definition of the practice of or policy of providing equal access to opportunities and resources for people with vulnerable backgrounds. And also in development agency asked for an evaluation template or evaluation matrix. And we provided this matrix with key questions, and in the diversity and inclusion part, we considered the level of consideration of age, gender, disability, and other diversity and inclusion aspects. Second, we considered the level of the needs of children coming from marginalized groups. We also considered the level of promoting equal access and opportunities to the various diversity groups. Also, a really interesting part that we considered the level of addressing structural and systemic causes of inequalities. And last but not least, we considered the level of increasing meaningful participation of children and child protection professionals. So in a nutshell, we had these four really main indicators and had these key questions, and the country evaluators used this template for the focus group discussions, and also for the online survey we prepared a template with key questions. So I hope this part was answered when it comes to diversity and inclusion.
Thank you very much to all of you for these interesting presentations. And thank you, Tobias, for also answering the question from the chat. People listening, please ask your questions by writing into the chat. While we are waiting, maybe I turn the questions back to you, researchers Tobias, Irina, and Ana. Was there anything surprising or unexpected for you during the research?
So I can just talk about the team and the 8 evaluators. So for me, it was really surprising that all were really motivated and active. Everything was in time, and they did more than expected. We got more answers, and also want to highlight during really challenging times, because the war in Ukraine started, and then in Romania, in Moldova, in a lot of countries in this region. I think it was really hard to organize the focus group discussions and get the policymakers on the table. And I think it was a really great work from the country evaluators. And when it comes to the field phase, I want to hand over to Irina and Ana, what said you answer the question from you.
Irina, do you want to come in?
Yes, I wanted to say something about how amazed I was about the feedback on the learning and the mentorship and the peer-to-peer sessions. Professionals in Romania were really benefiting from the opportunities to be put together, to discuss, to exchange ideas, methods, perspectives. They really feel the need to have moments of reflecting together. Some of them maybe are working in multidisciplinary teams, but maybe some do not. And besides the materials that an expert can publish on a website and everything, they learn most from interacting with each other and from exchanging ideas and opinions and even courses of action. And that was the most. Claudia joined us in the meantime, and I wanted
if I can add something else, is that they discovered that they have resources for these peer-to-peer and mentoring programs inside the institutions, and this is what they found, that is not a need to bring an external expert to discuss about the thing, because sometimes you have this resource inside your institution. And due to the fact that in Romania we have this very big institution for social assistance, sometimes these mentoring programs and peer-to-peer learning was a way to discuss to each other, to learn what kind of things other parts of the institution do in this field. And I think this was the most important part of the program, besides the platform. The platform was something else. Everybody discussed about the platform. And also it was for them, it was surprising to not only to learn new information, but also to find in these sessions about how they can develop on their personal way, let's say, how they can develop their skills, how they can communicate better, or give time for reflection for them inside the organization. Thank you.
Thanks so much. We received an answer from North Africa, where they are also thinking of establishing something similar. How did respondents see the sustainability of the platform, and whether you've seen any evidence of links that were created between countries?
I can say something about this. I would suggest for sure engaging the most professional ones, because people need to connect, to network, to exchange. And this is one of the main, I think, successful factors of ChildHub, who are a majority of professionals from different sectors engaged, who are very willing and motivated to share, to exchange, and to contribute to support the other new professionals. This is one part. And the second one, the engagement of the civil society sector in furnishing the library with materials, with publication, with articles, is very helpful in order to make the ChildHub platform available and accessible to all the professionals, to parents, to teachers, to anyone who needs somehow resources to update time to time.
Thank you. I don't know if anyone in the audience is from Serbia or Croatia and could speak about links between countries or wants to mention anything. Then maybe I will, although I wasn't part of the research team, but if I may at least mention that one of the nicest aspects of the project was the links created between countries that speak the same language. And in this regard, of course, there was a big advantage among the ex-Yugoslav countries. So they had several mini exchanges, face-to-face as well as online. And there was a lot of sharing among professionals from those countries. We have another question to the researchers. What was the most surprising difference between countries, and what do you think generated those differences? I don't know if Tobias, if you were able to come back, if you want to answer first.
So I think similar, it was improvement of the quality of care and capacity building of professionals. I think it is a really key result of this project. It was very similar in all 8 countries. And the differences, I would go to the policy level, and that you have different challenges. Maybe I think the situation in Serbia is different to Croatia, and you have to consider the local context and think it's a main difference in this project. So on the one hand, the really high capacity building, and on the other hand, the challenges and difference on the policy level.
Thank you. I don't know if any other of the researchers want to come in. No, okay. We are still waiting for questions. So if you have questions, please add them in the chat. In the meantime, we have some of the national associates that were coordinating the project in the countries. And I wonder if you could come forward and say a few words about next steps or what you are planning for the future in terms of any continuation. I hope you can come in with mics. I know we had someone from Bulgaria for sure.
Hi, everybody. I'm Radostina from Bulgaria. I see that Judith is smiling, so it means that the microphone is working. Yeah, okay. I can say a couple of words about plans that we have, and we are actually not only planning but also organizing some things. We liked very much this format of webinaring, and it appeared that Using the online format is also very useful because we can gather for a short time, 1 or 2 hours, people, specialists, and even some users of the social services, and we can discuss in this online space the issues that are important for everybody. So we are organizing for June, for example, a webinar which will discuss the results of another research made in the work frame of a childhood protection project, which was the supervision research, and the supervision in the multidisciplinary teams. So our researcher actually will present the results for Bulgaria, and we have invited some people who have participated in this research and also people who are interested in it. So we will discuss the results in Bulgaria, the main findings, the comparison with other countries, and also this contradiction that we actually made a research about the practices of supervision in multidisciplinary team, but actually everybody spoke about any other kind of supervision, but not in this field. So we are dedicated to make this activity, making webinars as a constant activity of our center. And of course, the networking and advocacy for better childcare is also our mission. So we will continue doing this. So these are some aspects of our work that we had in this project together with the Terre des Hommes and other partners, and we will continue doing that. Yeah.
Thank you so much, Agostina, for coming in. And if I may,
Good to see you all.
Yeah. I see Dragana here. If you would kindly say a few words about plans in Serbia. Maybe she's not hearing me, sorry about that. It wasn't planned for the webinar, but I just saw some colleagues online. So if you have questions, please write them in the chat. We have some comments, and thank you very much for those kind messages, the congratulations, and also we are getting information from other countries where similar initiatives are underway. So thank you for those.
You did. I could fill in for Dragana.
Thank you, Valbona. Thank you. So Valbona
for a couple of minutes. So maybe we have some more questions in the Q&A session. I'm Valbona Cerciani. I've been the associate for ChildHub for 7 years, and I continue to be partly the associate for ChildHub in Albania. It is a little bit confusing, and it has been some confusion, at least for the Albanian beneficiaries, if you could say. Hearing and reading in some of the articles, this is the final conference of ChildHub, or we are at the end of the project, etc. But in the meantime, the platform continues. And most of the activities that people would go there to find or to refer to, it's still there and continue to be uploaded and updated. So what we are doing in Albania for the moment, we are continuing with providing resources, important and useful resources for the professionals in Albania, child protection. And also we continue with low scale but it is there of supervision sessions. There are 4 groups that we are working on. And that's very interesting and important that professionals in Albania continue to go through this experience of supervision and peer-to-peer support. Therefore, in any possibilities that we have to do some lectures online or webinars, we are thinking about it. Third Zone in Albania is continuing to be the holder of the project, and it intends to do so for the future as well. So we are still here and we will be here.
Thank you so much, Rabona. And yes, I do want to mention a few things. One is that while some of our speakers have been from Third Zone, this is not a Third Zone project. And I would like to mention that our partners included Save the Children, Northwest Balkans, who worked in Bosnia, Center for Youth Integration in Serbia, Brave Phone in Croatia, and we heard from Radostina from the Know-How Center for the Alternative Care of Children. And the platform also is a very open platform that we would like to keep open for any organization that wants to promote their work in child protection, including webinars and resources. And we have started an annual membership for organizations that want to be able to become editors of the ChildHub in terms of uploading their own materials, definitely related to child protection, or organize their own webinars. And this is a way for us to improve the sustainability of the platform. But as Rabona has said, and I want to ensure everybody that the platform, yes, the online platform will continue. We do have secured funding for it. And we are also working on content renewal, since it's nice to have a website, but it's only as good as we have new content on. So we are working very hard to continue working with volunteers who can help us with translations. And as I said, with other organizations who can contribute resources. And we're also working on different e-learning materials that eventually will make it up to the ChildHub platform. Also, I would like to thank the researchers who have been participating in this impact study. As Tobias has mentioned, the task was really difficult. We were really running against the clock to make it, also in very different circumstances. And we really appreciated all of your dedication and commitment and making the reports ready. We will make the executive summary and the country findings available on the ChildHub. So whenever this is ready, we will be publishing them and sending them out in a newsletter so that you can all read the results as well. They are public. I think, Miriam, we can put up the final poll. We just wanted to have some feedback from you about this current webinar. And then the recording of this webinar will be available in a couple of days on the website, wherever you have seen the introductory text of the webinar. So anyone who have missed this occasion, this live occasion, will be able to look into the recording. So let's just give a few minutes for the answers. Thank you very much for your participation. A special thanks to all the contributors to the webinar, our researchers and our associates for making it. And we will definitely see you soon in another ChildHub webinar.